At the Department of Health, we look at big picture data and we look at the information that's coming to us from the community. A great opportunity for us to look at and learn from what's going on in the communities, to check in with our partners. We have great partners in the community. We look into the schools, we work with them, see if they're seeing any changes, anything that's concerning them. We will reach out to the hospitals and see if there's an increase in visits regarding mental health issues. That's another opportunity for us to see what's going on in the community. And then also just really looking at our data overall. The Department of Health has a lot of different data, and we can look at that. And when people are in the community, what they can do is look for changes in patterns in people that they are around. If they're usually an outgoing person and then all of a sudden they become more sheltered or more withdrawn, that might be a good opportunity to check in with them to see how they're doing. So we have some barriers that we have to look at. That one of them is access to care. Can they get to a place that has mental health services? Do they have the payment or the insurance for the mental health services that are available? And then the other thing is that do they feel a stigma in searching for mental health services? If they feel a stigma in reaching out for mental health services, sometimes they will not do that even if they do have access. But the biggest problems that we see are things like transportation, access to care, but that combined with the stigma can really cause people not to seek help. Well, young folks today, they have a lot of different pressures on them, social pressures. They're constantly connected online. There's all kinds of things that are pressuring them to where we maybe haven't seen that in the past. So right now, what we look at is how we work with the schools and we check in with them to see how things are going. Are they seeing more increases? And when a parent sees that their kid is maybe changing their behavior or doing things that they normally wouldn't do, that's a good time to check in with them. But it is sometimes difficult to get and earn the trust of kids today and young adults. So that's an important part to try to establish those relationships before the mental health issues arise. Good community resilience happens when the community is well educated on mental health. They know about the services that are available. They can reach out to the different partners and see if there's services available for someone that they see is struggling. So looking at that, and then again, reducing the stigma, looking at how we can get folks engaged in mental health without feeling that they're not normal or that there's something wrong with them. That's really important, and doing a lot of health education and making sure that people understand that mental health, it may not be as apparent as you would hope in detecting it. So sometimes you may have to work a little bit with the person and find out what's going on with them. You're not going to see a bruise or a scratch or something like that necessarily with mental health, but definitely the signs are there.